Researchers at the Pennington Biomedical Research Center in Baton Rouge think they may have found a new compound to treat inflammation without some of the negative effects that current medications can have. Corticosteroid drugs are what doctors often prescribe right now, but researchers say there's a direct link between the steroids and the onset of diabetes. The new compound would continue to treat inflammation, but would not lead to diabetes. Our Valerie Poncetti met with doctors from the research center, and she has more on what they say could be a breakthrough.
Corticosteroid drugs are commonly prescribed to all types of patients.
Flonase, I think it's a nasal spray that people use for allergies. Prednisone, dexamethasone is another drug that's commonly prescribed. Methylprednisolone.
These drugs are used to slow down or stop inflammation in a variety of health problems, like skin disorders, some cancers, Crohn's disease, asthma, and others. But the medicines can have serious adverse effects.
People are developing increased obesity, elevated blood glucose levels, and it's leading to what's known as steroid-induced diabetes, which is a big concern. It's another form of diabetes.
Dr. Jason Collier and his wife Susan Burke Collier say the onset of diabetes from the drugs can happen as quickly as 4 to 6 weeks in some patients.
So what got us excited was, could we engineer a new class of compounds that had less side effects but retained anti-inflammatory properties? And if that were true, would they then be a new therapeutic for diabetes, particularly for type 1 diabetes?
And with the two molecules the Colliers have been working on in animal and human tissues, they think they might be close.
The next step for us is to get these into a live animal, mouse or rat, and if they're really beneficial there, the next step is obviously taking them to a human study and finding out, do we have a drug that might be an improved use over the current prescribed drugs.
In Baton Rouge, Valerie Poncetti.